Did you know that according to the Centers for Disease Control, over 70% of drug overdose deaths in 2019 involved an opioid? Recent studies in the state of West Virginia show that out of every 100 residents, providers are writing 69.3 prescriptions for an opioid. That is well above the national average of 51.4 per every 100 residents. Do you or a loved one struggle with opiate addiction? If so, you may want to consider treatment with Vivitrol or naltrexone injections. It is an extended-release intramuscular injection that is an opioid antagonist and used to treat both alcohol use disorder and opioid use disorder. The rapid effects of this medication prevent relapse and have been used as part of detox techniques. To avoid sudden opioid withdrawal, you must stop taking any type of opioid, including street drugs, prescription pain medicines, cough, cold, or diarrhea medicines that contain opioids, or opioid dependence treatments, including buprenorphine or methadone, for at least 7 to 14 days before starting Vivitrol. Vivitrol is administered in a 380 mg dose injection every 4 weeks. Overdose is still possible during treatment, so individuals taking Vivitrol must ensure there is no intake of opioids during treatment. Do not use Vivitrol if you have a known hypersensitivity to naloxone, Narcan, or nalmefene, Revex. Other individuals who should not use Vivitrol are those who are known to be allergic, have respiratory depression, hepatic disease, hepatitis, renal impairment, depression, suicidal ideation, or are currently experiencing acute opioid withdrawal. Individuals with a recent surgery should also not take this treatment. Do not take this medication if you are pregnant, may become pregnant, or are breastfeeding. This medication is not to be used in infants, children, or neonates. Do not take while driving or operating machinery, as this medication is known to cause dizziness. Side effects of Vivitrol include, but are not limited to, nausea, sleepiness, headache, dizziness, vomiting, decreased appetite, painful joints, muscle cramps, cold symptoms, trouble sleeping, and toothache. Serious side effects include depressed mood, pneumonia, mood changes, confusion, vomiting, and hallucinations. If any of the serious side effects mentioned are experienced, please notify your provider immediately. Also consult your provider if you have any serious allergic reactions such as skin rash, swelling of your face, eyes, mouth, or tongue, trouble breathing or wheezing, chest pain, feeling dizzy or faint. Some people have experienced severe injection site reactions, including tissue death. Some of these reactions have required surgery. Vivitrol must be injected by a licensed healthcare provider. Call your healthcare provider right away if you notice any of the following injection site symptoms at any injection site. These symptoms include intense pain, injection site feels hard, large area of swelling, lumps, blisters, an open wound, or a dark scab. Tell your provider about any injection site reaction that concerns you, gets worse over time, or does not get any better within a time period of 2 weeks after the injection. Naltrexone, the active ingredient in Vivitrol, can cause liver damage or hepatitis. Therefore, you should notify your healthcare provider if you experience any of the following symptoms: stomach area pain lasting more than a few days, dark urine, yellowing of the whites of your eyes, or tiredness. Your healthcare provider may need to stop treating you with Vivitrol if you experience signs of a serious liver problem. If you are comfortable with the side effects of this medication and want to get clean and remain clean, please contact your healthcare provider and ask about Vivitrol today. For questions or more information on Vivitrol, please call 1-800-VIVITROL. That's 1-800-848-4876. For immediate medical emergencies, please dial 911. All information from this advertisement came from the CDC website, pdr.net, vivitrol.com, and Google Images searches.